Dan was fairly new to co-responding, that he'd done his course with Kent Fire and Rescue Service, and he was on his 5th shout as a co-responder. And he was mobilised to a cardiac arrest, which turned out to involve multiple patients at a road traffic collision near where he lives and works, near where the fire station he works from. He attended on his own, and he was presented with a very serious scene, including people in cardiac arrest, people with major trauma injuries and other minor injuries. He managed that scene as a lone responder for about 15 minutes with the aid of a police officer and a passerby, until SECAmb and Fire and Rescue Service resources arrived to assist him. When he'd finished, or when he'd been co-responding, he then carried on to assist crews as required throughout the rest of the incident. So from my experience of dealing with incidents, from major incidents to multiple patient road traffic collisions, it's always difficult to make quick, accurate decisions around prioritising care and triaging. And the principles that Dan used, using the ABC training and his training as an ICR and his experience as a fire officer, all came together to allow him to prioritise the care that was needed and to maximise the chances of survival for those people involved in that collision, which would have been challenging to any member of our staff or any other member of the emergency services presented with that on their own and with limited resources available. It was outstanding because Daniel was alone. He was not an experienced co-responder. He was used to dealing with incidents like that as part of a crew of 4+ members of staff normally. So he adapted, he overcame the challenges that he had. He made some good decisions around what he needed to do with the patient in order to maximise their chance of survival, and he put those into place really quickly and really efficiently. Dan, along with all our Kent Fire and Rescue Service colleagues who respond on our behalf, are all valued. They are an integral part of the SECAmb response, as are our CFRs and other people who respond on our behalf. And this sort of incident shows that they can really make a difference for us and the patients.